So now that we've done the cams, there's obviously some areas of weakness that presented themselves. So we are going to do some tests to see, test out different muscles or different regions, and see what type of weakness, see how they're contracting, and seeing if we can do anything in terms of helping get those muscles firing the way they're supposed to.
Okay.
Okay. So the first one we're going to focus on is the GlutMax. So the GlutMax muscles, obviously, that whole big muscle, but it's divided into like 3 different sections. So you have the iliac fibers, the sacral fibers, and the coccyx. So we're going to focus on the sacral. Okay, so what I'm going to have you do is I need you to turn onto your stomach.
Okay.
And you can put your face in the face pad. Good. And good. All right. So now what I'm going to have you do, just kind of stay, you can have your hands by your side, nice and relaxed. You're going to just abduct your leg just a little bit here, and then you're going to bend your knee, bringing it to 90 degrees. Okay. So now from this position, what I'm going to have you do is I'm just going to put my hand underneath your knee just to have just support. I'm going to have you extend your hip, which means you're going to lift your leg off of the table. Okay, good. Now that you're in this position, I have you, so I want you to relax your leg as much as you can into my hands. So just relax it, relax, relax. I have the weight of your hand. Okay, so now what's going to happen is I'm going to bring my hand here. I'm going to press down. What I want you to do is I want you to focus on try to hold the resistance and keep your leg in the same place. Okay, as I press down, you hold. Okay, so on the count of 3, I'm going to press and you're going to hold as much as you can.
Okay.
So ready? 1, 2, 3, hold. Good. And come right back down. Okay. So I'm just going to go ahead, basically I'm going to go to the fibers that we were just working, and I'm just going to go ahead and do a little bit of palpation in those fibers along the sacrum here. Let me know if, you might have some tenderness in this area, you might not, it just depends on.
No, here I'm fine.
Yeah. And then we're going to come over here. This area?
That's tender.
Yeah. One more area. We're here basically trying to kind of get the gamma neurons, these neurons starting to fire and kind of respond, which is why we do the palpation. So, okay. So now we're going to go ahead and try that exercise again. So you're going to go ahead and bring a 90-degree angle. I'm going to grab my hand underneath. Now relax for a moment. And then you're going to extend the hip, again, bringing it up. Good. And now relax your leg, put the weight of your leg into my hands. Okay, we're going to do the same thing. So on the count of 3, I'm going to be pushing and you make a point to hold. Ready? 1, 2, 3, hold. Good. And relax. That was excellent. Excellent. Okay, so I'm going to do a little exercise with you. So now in this exercise, this is a pick. You're going to be holding each of these for 6 seconds. We're going to do 6 different times. But I will go through the instructions in terms of what to do. So you're going to go ahead, again, bring it 90 degree. We're going to put it in the exact same position as you had it. Okay. So now go ahead and extend at the hip one more time, and then relax the weight of your hand, or the weight of your leg into my hand. Now, staying here, so now relax. Yeah, relax that. Now, do you feel the weight on my hand, correct?
Yes.
So now I want you to lessen that weight just about 10%. So you're just going to lift it, that's it. Hold 6, 5, 4, 3, 2, 1, and relax. Relax it, put the weight back in. And again, you're going to soften again, just 10% off. It's almost like lifting off slightly off a pillow. So go ahead and bring it up. Good. 6, 5, 4, 3, 2, 1, relax. And again, that's it, just like that, not any more than that. 3, 2, 1, relax. You have 3 more here. And again, 6, 5, 4, 3, 2, 1, relax. Make sure not to do more than 10%. It's really a small movement. We're just trying to make sure that low back doesn't come into play or any of the other muscles. Here we go. And that's it. 6, 5, 4, 3, 2, 1. And we have 1 more. And again, last time. 6, 5, 4, 3, 2, 1, and relax. Good. Should feel that it's engaging those glute muscles, but not kind of minimizes the use of our low back. We tend to use our low back muscles a little bit too much in that.
Okay.
Okay, so now we're going to actually check your psoas major. So you can go ahead and turn onto your back and slide down off the table. Okay. And again, on this side, yeah, we're actually going to stay on this side. So, psoas major, just to kind of give you an idea, the muscles, they connect to different bony process and along the spine.
Okay.
And it kind of goes right around kind of like the rib cage, all the way down to like L5, beginning of your sacrum.
Okay.
And then they attach kind of further down here. When I get to the points in terms of palpating, you'll know. But what I'm going to have you do is you're going to go ahead, staying nice and relaxed. I'm going to have you externally rotate this leg. So you're going to turn it out. Okay? So now I'm going to actually just keep my hand here just to help keep you externally rotated. You're going to take it out about 30 degrees. So bring it out until you feel my hand. Good. And now from here, I want you to bring it up. We're going to flex it about 45 degrees. So bring it up to my hand right here. Good. Excellent. And now in this position, I want you to go ahead and relax as much as you possibly can. So.
I got a cramp in my leg.
Oh. Okay.
Sorry.
we reset.
Yeah,
Where was the cramp?
Right here.
Right there in your quad?
Okay. Yeah.
Go ahead. Let's
Sorry.
just do a quick reset. So go ahead, bend the knees, bring your hips all the way up. Yep. And right back down. And good. And again, so we're going to start again. Let me know again if that happens. Not a problem.
Okay.
We'll take care of it. So externally rotate, turning it out. Okay, I'm going to help keep it externally rotated. Now bring it out 30 degrees. Bring it out till you feel my hand. Good. And now we're going to bring it up 45 degrees. So bring it up till you feel my hand. Good. Okay, so now in this position, what I want you to do is you're going to relax your leg into my hand. Same thing as before is I am going to be pressing kind of down and out. Your job is to hold the leg in that position, okay? So when I tell you, you're going to hold. Ready? 1, 2, 3, hold. Okay, good. Can you point to your belly button for me? Okay. There you go. Okay, and take a nice deep breath and exhale. And this might be a little tender. Okay. Okay. Take another nice deep breath. Exhale for me. Good. Go ahead and bend that knee. You're going to open it up towards me. Yep. And my hand is against the inside. I need you to press the inside of your leg into my hand. There you go. And good. Okay. Just needed to find a fiber. Go ahead and open it back up. This tends to be painful for a lot of people, so I imagine by your face it's painful. Relax for a second. Okay, we're going to try that test again, okay? So again, we're going to start with an external rotation of the leg, and I'm going to help keep it right there. Bring it 30 degrees, so bring it out till you feel my hand. And then you're going to bring it up till you feel my hand at 45. Okay? And again, relax the leg, keeping it right there. We're going to do the same thing. So I'm going to press down. You are going to try to hold on the count of 3. 1, 2, 3, hold. Good. And relax. Excellent. Okay. So, just as we did before, the PIC would just, it stands for positional iso angular contraction. So,
Okay.
I'm going to put you in the same position as you were just in, but we're going to do those 10% lifts, just minimal lift. We're not looking to lift the whole leg. So again, you're going to turn you're going to turn external rotation, bring it out 30 degrees where my hand, there you go. Bring it all the way up to 45. So now I'm going to go ahead and hold this, so then that way I'm going to help keep it externally rotated, but you can relax your weight into my arms. Okay, now from this position, what I want you to do is you're just going to lift 10%, just slight enough to engage those muscles. So go ahead, lift. That's it. 6, 5, 4, 3, 2, 1. Relax. Relax the back. And again, you're going to lift. 6, 5, 4, 3, 2, 1. Relax. And again, 10% off. That's it. No more than that. 6, 5, 4, 3, 2, 1. Relax. You have 3 more. Again. And 6, 5, 4, 3, 2, 1. Relax. Last 2. And 6, 5, 4, 3, 2, 1. Relax. And last one. 6, 5, 4, 3, 2, 1, and relax. Good. Excellent. We're going to bring it down and in. All right, so those are the 2 that we're focusing on today.
Okay.
Obviously, there's some more work that we can do, but that is it. Thank you so much for being my little patient.
Pleasure. My pleasure.
Appreciate it.
Okay, thank you.
No problem.